The word open or closed rhinoplasty indicates the approach. With a closed rhinoplasty, all the incisions done for the surgery are hidden within the nose. With an open rhinoplasty, you invariably make an external incision, usually just under the nostril, which allows you access to the nose. They're both approaches. What you're going to achieve with the surgery is a completely different segment. What can be done with the surgery? What are the potential consequences, advantages, limitations, side effects are what really determines what technique you're going to use, which approach you're going to use. Often the technique of what we're going to do within the nose doesn't change. It's just how you approach that structure is what changes with an open and closed rhinoplasty. So closed rhinoplasty surgery, normally the incisions are made within the nose. Usually very good if you're going to be addressing, say, the hump of the nose, where you have problems with the bone, the bridge, the alignment of the nose, can be very effective in changing the tip of your nose. The lower part of your nose can be changed as well. However, if you need a lot of radical changes, reconstruction, or quite substantial grafting, then usually we would use an open approach rhinoplasty, whereby we make a cut here, and that gives us a better access to the structure of the nose to be able to do those reconstruction or grafting techniques. The disadvantage of the open approach rhinoplasties is a bit more invasive. By making a cut here, you reduce the blood supply, you reduce the sensation to the tip of the nose, which then takes a lot longer to settle down. And the key thing that we try and preserve in rhinoplasty surgery is the structure and substance of the skin. It'll affect the stiffness, the integrity of the skin, and the sensation of the nose. So, rhinoplasty journey within Zenith. It's really a structured and interactive approach. First session really is about me understanding what are your main concerns about the shape of your nose, getting some perspective of what other symptoms you have, what your medical history is like, and more importantly, for me to take images of your nose, be able to morph them along the lines of what I believe you're trying to achieve and what can be surgically achieved. It's so important that what you want to change and what can be achieved surgically match, such that the journey is going to be a successful and a happy one for you. The first session is really focused entirely on that. We take images of you. During that session, I will amend them, morph them along the lines of the changes that I understand you're trying to achieve and what can realistically be surgically achieved. These images are then shared with you, so you have time to think about what we have proposed. You have a time to think about the kind of changes that can be made, and then make a more informed judgment whether that is what you want, that is where you would like to go to, or whether you feel there are other factors now that the main concern has been addressed. It may give rise to other questions that you didn't identify originally. Those aspects we then take up on the second session. We would normally give you at least 2 to 4 weeks between the sessions, so you have adequate degree of time to think about what's been stated, and also think and re-look at the images and share them with your loved ones so you can get some feedback as well. The second session is really revisiting the original morphed images, ensuring that you concur, you agree with the kind of changes you're planning on, and we home into the exact changes that are going to be made. After that, it's my role for me to make sure you understand what the surgical journey is about. In other words, the risks related to the procedure, how long will it take for you to recover, what are the things that can go wrong, how does the nose settle over time, or you have any particular questions such as, when can I start doing exercises again, when can I go out, when I go back to work. All of those are then answered at the second sitting. We also take that opportunity to really review images of lots of patients, individuals who've had surgery with me before. And ideally, I choose images of the kind of changes being made in line with the kind of changes you're looking for. And that way you can get a perspective of what they started off with, what was the image presented to them in the form of a morphed image of what the result could be and what the end result was. Because there always will be variations. You can change images on a computer very easily, but that really needs to equate as closely as possible to what the end result is going to be. That degree of variation you're going to get between the morphed image and the reality is something that you need to be able to perceive, and that's what these images, this second session gives you the opportunity to get to grips with. At that stage, we would then let you assimilate all the information. You would have all the cost structure, you'd have the images, you'd have all the information, both written and verbally, and then you make a decision whether you feel that that journey is worth taking for yourself. We often will see individuals more than 2 times because sometimes these questions come up later on, and for me to take you to a surgical procedure, I want to be confident that all your questions, all your doubts, all your concerns are entirely cleared and answered before the day of the surgery. On the day of the surgery, you'll be a little bit nervous, but you shouldn't have any questions, you shouldn't have any doubts, you should not have any thoughts, what if, or should I be doing this? We really want to be sure that we answer all those questions before we start considering the day of the surgery. The day of the surgery is very well structured as well. You come to the unit here, you're seen by anaesthetists who I work with and have worked with for 20 years. We work as a team, we know exactly how each other works. We have a team, they have the same surgical team that performs the procedure. It's done as a day case. You come in the morning, go home the same day. You go home with all your medication, information on do's and don'ts afterwards, and then you'll be seen back in the clinic either at 1 week or 2 weeks after your procedure. At that point, your external or possibly occasionally internal splints will be removed, and then there is a progressive healing process. We would normally see you in the clinic on multiple occasions. You'd be followed up for up to a year, usually seen at 1 or 2 weeks, at 3 months, 6 months and a year subsequent to surgery. And that is all included into the surgical package for me to be sure that you have completed that whole healing journey, and for me to be sure that you've come to a place where you are completely stable and happy with the result. I'm a specialist in noses and rhinoplasty surgery. I do not perform other forms of aesthetic surgery. Rhinoplasty is probably one of the most challenging facial aesthetic procedures, and my aim in life is to master that. The other aspect that's very important is that over the last 20-30 years, so many different techniques have developed in this area. To master this area, you need to be able to handle and keep up to date with all these techniques. So my approach very much is bespoke treatment for the patient. You have to tailor the technique for the concerns of the patients, for the structural anatomy, such that you're going to get the optimal result for that individual and that nose for that person. And for achieving that, you need to have the width of knowledge and a dedication to a specialist area of expertise. And I think I will approach your procedure with open or closed with multiple different techniques to achieve the same, but I will create a bespoke surgical package for each individual that comes under my care.